Okay, today let us understand the active management of the third stage of labor. So, what is third stage? From the minute the baby is expelled till the placental separation stage is the third stage of labor. Third stage comprises of one is placental separation, and after the placenta is separated, means this is the placenta where if it is separated, this has to get expelled from the uterus. This is called an expulsion of the placenta. So we have to understand first who will aid this placental separation. This placental separation is aided by very important cause, that is the uterus, which was so big during the pregnancy, comes to a very normal size. It comes just below the umbilicus and it becomes a discoid in shape. The surface area was of which the placenta was attached previously. Now it decreases to a very less area as the placenta is now inelastic. It cannot sustain this. It cannot sustain the retraction of the muscle fibers, and thus the placenta gets separated. Here, the blood vessels which were there, they broke and they form a hematoma. This hematoma, by the gravity, pushes the placenta downwards, and little by little, the placenta comes out. If the hematoma collects here and the placenta comes out first, followed by hematoma, this method is called as central separation of the placenta, and this is called as Cult's method. And if the hematoma which is collecting here, if the blood seeps out laterally here, just at the one margin of the placenta, this is called as Duncan's method, and this is a most common method of placental separation. After the separation of the placenta, now the placenta is lying inside the uterine cavity. It is just separated. The uterine contraction followed by the separation of the placenta aids the expulsion of the placenta, and also the bearing down efforts of the mother aids the expulsion of the placenta. Now coming to the mechanism of control of bleeding. Now we have understood in the third stage there is separation of the placenta. Behind that there is clot formation. But in this third stage, a very important thing that we have to do is somehow control the bleeding. Otherwise, the patient may land up into postpartum hemorrhage. Normally, not every woman do land up into postpartum hemorrhage. So, ideally, there are some factors which are God given, which will prevent the clot, which will control the bleeding, which will control the excessive bleeding. One is this interlacing myometrial pattern. Normally, other muscle fibers like skeletal muscles, they are arranged parallelly. They are arranged parallelly, side by side. But in this muscle, you have interlacing muscle pattern between which this blood vessel passes. And when the muscle do get contracted, they will stop the bleeding. They will occlude the blood vessel and stop the bleeding. And the second cause will be thrombosis. Because the pregnancy is a hypercoagulable state, the blood vessel leaking over here, it will stop on its own because of the thrombosis present in the body. Third will be the myotamponade. What is myotamponade? Whenever the two surfaces of the uterus oppose each other, they will cause pressure on each other's surface, which will lead to the control of the bleeding. So, how do you manage this third stage of the labor? There are two types of management. One is expectant management, and other one is the active management, which is today's topic. First, I'll tell you the expected management, and then we will understand why this active management has to be done and how it is important in the obstetric practice. Expected management, we get to see nothing but just a constant watch. You just keep your hand on the uterus, but do not massage. You just you just keep the hand on uterus to watch the signs of placental separation. I mean, if the placenta is separated from the uterus, the size, the discoid shape of the uterus won't be there. And the size usually just after the delivery, it will be just above the umbilicus. As soon as the placenta separates, it will go below the umbilicus. And you also see the cord lengthening and the bleeding. So you watch for all those signs. and you wait until the placenta comes out. This is expected management. You can wait for 15 to 20 minutes. Coming to active management. What can we do in the active management? Why this active management is very important for us. In all over the world, the most common complication which is occurring and which is complicating our postpartum hemorrhage is anemia. For a normal person whose HB is 11 gram, loss of 500 ml of blood does not decompensate it. But for a person whose HB is 7 gram, loss of 500 ml of blood do put the patient into decompensation. So, our principle behind this active management of third stage of labor is as soon as the baby comes out, you will not even leave a minute to the blood loss to happen. You will just excite a powerful contraction by giving oxytocin or methogen so that there is early separation of placenta and there is effective uterine contraction. So this minimizes the blood loss up to 1/5 and the duration of the third stage is decreased to half. But as in cases of expected management, you just wait for nature to take care about this uterine contraction and normal thrombosis to occur and myotamponade effect. But here in this active management, you are giving a powerful uterine contraction by giving the external drug. What is the disadvantage? Sometimes because you're separating you're just giving a contraction immediately after the delivery. Sometimes the placenta might get retained, or sometimes in a rural side where no scans are available and no proper obstetrics facilities are available. If there is an undiagnosed twin, as you're giving oxytocin just after the delivery of the first baby, the second baby might won't get delivered if you just give oxytocin, which causes strong contraction in the uterus and might lead to the fetal distress. So, in this active management of the third stage of labor, as I told you, you can give oxytocin 10 international units IM within 1 minute of delivery is advised. You can give as early as crowning or when the anterior shoulder is delivered. And the second step is as you wait and see whether the placenta is getting separated for a while. But if not, you start with a control contraction. Like as an expected management, you cannot wait for 15 to 20 minutes. Immediately, if you're seeing the placenta is getting separated, then it is fine. Otherwise, you should start the controlled contraction method. The other name of controlled contraction is Brand's Andrews technique. What do we do in Brand's Andrews technique? One fist. You keep your one fist to the just above the pubic symphysis as the uterus is anteverted, and I will show you the picture. Controlled contraction. So in this controlled contraction, the one hand is just kept above this pubic symphysis. As you're seeing here, your uterus will be anteverted and your push will be upwards and forward so that this uterus is not coming down whenever you're pulling the placenta. And you will you will not pull the placenta, but you will just give a little bit of traction because you are pulling the unseparated placenta. So you are just giving a traction by controlling the uterus so that it won't get inverted. Are you understanding? You are giving a controlled, which is controlled contraction. Your control on the uterus with the traction on the cord is controlled contraction so that this will aid the separation of the placenta and thus will minimize the blood loss. When you take out the placenta as early as possible, this third stage of the labor will be shortened and there will be early contraction of the uterus. And also whenever you take out the placenta, there will be myotamponade effect, which is given now in the early stages in order to prevent the blood loss. So this is a chart that you can write it in your exams. This is the expectant management. Here you deliver the baby. You just clamp, divide, ligate the cord and give it to the pediatrician. You just wait and watch. You can catheterize the bladder as the bladder will hinder the descent of the placenta, and you can guard the fundus. Just keep your hand on the fundus, but do not massage, and wait for spontaneous separation of the placenta. If placenta is separated, well and good, or you wait for spontaneous expulsion with the aid of gravity. Then also if it fails, then assisted expulsion is required. Then you can give oxytocin 5 to 10 international units slowly, IV or IM, or methergine 0.2 mg IM. Then next, let us see our active management of third stage of labor. In active management, you are giving oxytocin as soon as the anterior shoulder delivers or the methergine is given within 1 minute of the delivery of the baby. Then to deliver the placenta by controlled contraction soon after the delivery of the baby, availing first uterine contraction. So you do controlled contraction as soon as the delivery, as soon as the oxytocin is given. If it fails, then you repeat the controlled contraction after 2 to 3 minutes. Again, if it fails, you wait for 10 minutes and repeat the procedure. Even though after that, if it fails, you can go for manual removal. By taking all the aseptic precautions, you remove the placenta with your gloved hand, and after that, you examine for the placenta and the membranes. This is the active management of third stage of labor. Apart from this, you have to know about the postpartum hemorrhage that we will learn in the next lectures and how to prevent the postpartum hemorrhage.